Hey guys, I'm Christina Denny.
And I'm Chardell Moore, and welcome to our Facebook Live with GBMC Healthcare. Today is all about Alzheimer prevention, signs, symptoms, and updates to this disease.
Yes, very important conversation
yes.
we're having. GBMC neurologist Dr. Oluwatosin Thompson is with us today to give us the lowdown and answer all of your questions.
Woohoo!
So please don't hesitate to ask us anything in the comments below. We want to hear from all of you.
Yes.
Thank you so much for being with us.
Good to be here.
And he looks incredibly sharp. We have to mention his fashion. So let's get right into it. Talk to us about Alzheimer's.
Yes, Alzheimer disease is a condition that causes the death of neurons due to normal buildup of certain proteins in the brain, and it causes a host of symptoms. Most early ones being difficulty with short-term memory and difficulty in handling complex tasks.
Oh, interesting. So what is the spectrum of symptoms? Since you say it starts off pretty minor, some memory loss, then what does it develop into?
Yes, absolutely. So it begins with some short-term memory loss, and then over years and with time becomes more and more severe. And you can have increased difficulty with navigating space, which can show up as getting lost easily or getting lost in spaces that were otherwise familiar in the past. Things like that can happen. And people can have difficulty in changes in mood, so people can get more anxious, more irritable, depression, so people can just show apathy, not really caring about things anymore. And some might not even realize that they have cognitive issues at all, which is a common symptom. And then later on, at the very end of this disease called Alzheimer's, people can have more difficulty with accomplishing tasks necessary for independent living, such as bathing, toileting, dressing, feeding oneself. And in that phase is what we call dementia.
Oh, okay.
And what is the biggest difference between Alzheimer's and dementia?
Well, that's a good question. In a sense, Alzheimer really is the most common cause for dementia, and there are many causes, but Alzheimer's is the most common cause.
So it's like a gateway, kind of?
It's just one of the causes, but it's the most common cause. So the very early stage of the condition, we call that mild cognitive impairment, where people have difficulty with memory, but they can still go about their lives. But their loved ones, they may realize that I'm more forgetful nowadays. And then as things progress, they may go on to the point where they can't accomplish life independently anymore, and that stage is called dementia. And Alzheimer's is one of the causes for this.
So can somebody have dementia separately from Alzheimer's?
Yes, there are a few other common causes for dementia that isn't Alzheimer's, but in our day and age and in our country, Alzheimer's is the most common cause for dementia.
Okay, so let's get into the risk factors that we should be aware of.
Yes, very good question. So age, as we know it, is the greatest risk factor for Alzheimer's. As we get into our mid-60s and beyond, the incidence of Alzheimer's does increase. But there are other things too that we've realized over the years that can predispose one to this condition. Having certain variants of a gene can increase the risk factor for Alzheimer's disease. And we also know that having a first-degree relative, so having a parent or having a sibling with Alzheimer's disease can increase the risk factor for others in the family to get this condition. But we've also found that having cardiovascular risks can also increase your risk of having this condition. So having high blood pressure, high cholesterol, untreated diabetes, so on and so forth, can increase the risk for Alzheimer's. And of course, traumatic brain injuries can also increase one's risk with this condition.
See, that's why it's so important to go to the doctor regularly.
Yes, indeed.
And to keep yourself healthy and calm, keep that blood pressure down.
Mind, body, soul, and spirit.
Yes,
Exactly.
self-care is definitely the word.
Definitely.
So apart from, say nobody in your family has Alzheimer, any sort of dementia, memory issues, can you still develop it?
Yes, it can happen sporadically, as we say. So we're still understanding what really causes this condition, the ins and outs of it. Those things I mentioned are some things that we've found to be true over the years, but we don't fully understand exactly what causes and why, as we get older, we have more of a risk for this condition.
Yeah. Interesting. And it really affects the caregivers and just, everybody around, the person who is sick.
It does. It does. It can be quite an intense experience to have to care for a loved one. I mean, not only having to watch them decline in this way, but of course, the time commitment and the financial strain that can bring to is also, very significant things that can happen to those caring for loved ones with Alzheimer's.
Yeah.
Yeah.
So you touched on some of the symptoms earlier. Say we are a caretaker. Are there certain things that we should look out for in others to kind of say that something is not quite right?
Right, very good question. Often, I find that the spouse or the children are the first ones who begin to realize that their loved ones are having issues. So increased difficulty with memory. Everyone has some difficulties. We all get older. But if you notice, this is just going beyond. Often people report to me they're having to repeat themselves more often to their loved ones, or their loved ones are repeating themselves more often to them. It can be an early sign of it, or getting lost in places that they otherwise would not. So, getting lost driving back home, which on a route that the loved one has taken for years, can also be signs and clues that we should probably go see a doctor and have this investigated further. Yeah.
Is there anything that we can do to reduce our chances of being diagnosed with this disease?
Yes, very good question.
Yeah.
We've found that reducing the cardiovascular risk factors is a very important step in reducing one's risk of developing Alzheimer's. So making sure you continue to work with your healthcare provider to treat hypertension and diabetes, high cholesterol is important. And of course, probably most importantly is self-care, living a healthy lifestyle. So a good diet, exercise, and making exercise and a good diet a part of your life is also very important. And of course, reducing the risk for traumatic brain injuries. So making sure you're wearing a seatbelt when you drive in your car, making sure you're wearing a helmet when you're riding your bicycle or your bike. These are all important things to reduce the risks for traumatic brain injuries that can predispose one to going on to developing things like Alzheimer's.
Yeah.
So what do you say is the typical age of patients that you see who are coming in and getting their first diagnosis?
Yes, I would say about 65 or so. It's typically the most common time that people begin to come in and present to clinic with these sorts of symptoms that can often point to the diagnosis of Alzheimer's disease.
Is there like a certain demographic that develops Alzheimer's, that's more prevalent in their gene?
Yes, so we don't know of any demographics per se. We do know over the years that it seems to be more common in the elderly population, and but really beyond age, that's all we know of as the most common risk factor for this. Beyond that, it really spans across gender, across nationalities, across socioeconomic status and things like that.
Absolutely.
Yeah.
And there is a viewer right now who can relate to this. The first step, if we notice something, what should we do?
Right. So I believe the first step, of course, is to bring them to your primary care provider and discuss these symptoms with them. Often there are a number of things that can be done at that stage. And if the primary care provider feels that this is something that should go on to be seen by a neurologist, then that, of course, would be the next step in evaluating this condition. So I think just the first step is always go to see your primary care provider first to discuss symptoms.
Definitely.
Absolutely, yeah. Go to your doctor if you have any questions
Right.
whatsoever. Your health is your best investment. Don't risk it.
We talk about it all the time. It's the reality, though.
Yes.
So I have
yes.
an interesting question, and we might be delving into some theoretical realm here, but do you have an opinion on how sports, particularly sports like football or rugby, where there's a lot of impact,
Right.
could potentially cause an issue that could lead to Alzheimer's later on down the road?
Right. So, we have to say we don't know those answers quite yet, for sure. But what we do know is that, head trauma, traumatic brain injuries, is a risk factor for developing Alzheimer's disease. So of course, you're mitigating those risks by making sure you have, the recommended headgear, head protection when engaging in whatever activity, even something as simple as driving or riding a bicycle or skating or whatever, to prevent those risks for developing or sustaining head trauma will be important.
So how can this disease actually be treated?
Yes, a very good question. Unfortunately, as we said, there's really no known treatment for Alzheimer's disease. And thankfully, a lot of good research is being done all over the world as we speak. And to really delve into this topic of how do we manage this effectively, how do we treat this?
It's tough.
It is a tough thing. And we're hopeful that, as the years go on, as the months go on, we actually we get more and more clues, and in the future maybe find a cure to this condition. So really all we have right now is addressing the risk factors for those who don't have this condition, reducing the risks for developing Alzheimer's disease. And for those who have it, doing things to reduce the decline that we see. So we find that maintaining social interactions and keeping the mind active is very beneficial in slowing the decline for those who have Alzheimer's disease. So, continue to interact with family, with loved ones, with neighbors, even going to, volunteering during the day, anything that keeps you interacting with people does help keep the mind sharp and keep the mind active and reduce decline.
And do you have any motivation or inspiration for the caregivers, because it's so difficult for them?
Yes, all I can say is that there is help out there. We know the Alzheimer Association has a helpline out there, that they can speak to someone. Your physician is a resource to you. Your provider is a resource to you. And of course, I always try in my visits with my patients to reach and talk to the provider and ask them how they are. And so I think always for them to feel comfortable in expressing their feelings. Often I think we feel guilty in just saying that, we're tired, this is tough, this is hard. And sometimes just expressing that can go a long way to reducing those feelings of fatigue that is very common on the caregiver side.
Mm-hmm. Good to know.
Right.
And we have a question from Courtney, and Courtney says, can symptoms be slowed down once noticed?
Thank you, Courtney.
Yeah, good one, Court.
Yes, so thanks. Right now, we know that maintaining just social interactions, keeping the mind active, are things that one can do to slow symptoms down for Alzheimer's disease. And when it gets even to the more severe stages, there's some medications out there that can be provided that does seem to help in slowing symptom progression down and in maybe reducing some symptoms. But right now, there's really nothing very, very strong out there to help reverse symptoms of this condition.
So just stick with what you were saying. Keep
Exactly.
the mind active, keep socializing,
Exactly.
play Sudoku, whatever you need to do to keep your brain going day to
Right.
day.
It's important.
So I have a kind of unrelated question. We were chatting about this off screen a bit beforehand. So we're all way into the DNA testing right now. And there are some services that give you health variants. And for transparency reasons, I got a variant for late onset Alzheimer's. Should I be worried? What do I have to, what do I do with that information?
Great question, Christina, because I'm sure so many people out there are doing the same thing.
Yes.
Right.
I have to begin by saying we don't completely understand everything yet about this condition. We do know that, of course, there's some who have these genetic variants that do go on to get this condition, but then there are many too who have these variants who don't never go on to get Alzheimer's disease. So clearly we can't pin everything on this, I have this genetic variant, so I'm going to get this condition. It ends up not being as straightforward as that, which can be good news for many who've gone to take these tests and do find out that they have this, these variants.
Right, I'm sure, and it's much more than just, the one variant that goes into
Right.
this very complex disease.
Exactly.
Absolutely.
Exactly.
Well, thank you for making me feel a bit better.
You're welcome.
So we have a comment from Joe, right, Christina?
Hey, and Joe says, name some medications. Are there any particular medications that have been shown to be particularly beneficial?
Yes, very good question. There are some medications out there. There are certain family of medications that sort of modulate the acetylcholine, receptors. We know donepezil is one that's very commonly prescribed to help reduce the progression of Alzheimer's disease. Rivastigmine and so on and so forth. Memantine is another medication that also acts on a different receptor in the brain. And these have been shown to have a modest effect in reducing the progression of this condition. But once again, nothing out there, there's no cure for this condition, unfortunately, and nothing that's been shown to be really very, very effective in reversing things.
So would you say Alzheimer's is deadly?
Well, I would say certainly with the appropriate care, maybe people can go on to live, good lives with their loved ones. But unfortunately, it does progress, and it does lead eventually down the line to severe cognitive impairment, and that can go on to cause eventual death.
Gotcha.
Interesting. And we do have another question from Brielle. Brielle asks, do symptoms of the disease vary day to day? That is a great question.
Yeah.
Thank you so much,
Yeah,
Brielle.
very good question. So very early, the common symptoms include increased difficulty with recent or short-term memory, increased difficulty with navigating spaces, getting lost more easily, difficulty with accomplishing complex tasks can also be a symptom. So it's not uncommon for loved ones to see this symptom to be maybe more prevalent on one day or the other. But by and large, when you take a step back, it's really the same constellation of symptoms that you're seeing, maybe a little bit worse on one day to the next. But what we do see is a gradual progression and increase in severity in all those cognitive domains.
Gotcha.
Yes.
Is there certain like mental exercises that we can do to help strengthen the brain?
Yeah, so we found that anything that anyone enjoys to keep the mind active is very beneficial in reducing the progression of this condition. So
That's good to know.
Exactly.
Yeah.
What we find, the very most simple thing is just maintaining social connections. You know, the very act of having a conversation with someone and expressing ideas and exchanging ideas and thinking about what you want to say and expressing yourself. There's so much mental gymnastics that goes into that's in itself is very useful in keeping the mind active. But whatever it is that you enjoy, reading, be it writing, be it whatever it is that you like to do, playing music, creating, whatever it is that you enjoy doing, as long as it's something that you find mentally stimulating, is good.
Good to
Okay,
know.
so it's kind of in the same realm of exercise. If
Yeah.
you're going to do it, that's the best thing to do.
Right, exactly.
Yeah.
Exactly.
So we have another question. Let's see. So Beth, what's the difference between Alzheimer's and dementia? We kind of talked about this, but we can just touch on it again.
Recap, absolutely. So Alzheimer is the most common cause of dementia, and Alzheimer causes a spectrum of disease severity. At the very early stage, we call that mild cognitive impairment, where you may have difficulty with memory and other things, but you're still able to live independently and still carry about your life as you used to. But then at the very end, the very severe, most severe stage, it's what we call dementia, when you have difficulty accomplishing tasks needed for maintaining independent living, like dressing, bathing, feeding oneself. And at this stage, that's what we call dementia. Now, Alzheimer disease is one of the varying causes of dementia. It's the most common one.
Interesting. So when patients come in to see you, or say they're with their family members, what is the number one concern that you usually hear from them?
Right. For me, it's often about what is the future going to look like for us if my loved one continues to has this condition or continues to progress with this condition. What's the future looking like for us? Is there a cure? And many of the questions that we've touched on today. And I just try to provide some hope, telling them very, very intelligent people all over the world are looking at this very question as to how best to manage this condition and looking for a cure for this condition. So I believe there is hope in the fact that there's a lot of research and a lot of great minds looking at this very question that we all have.
That's good that there's so much research out there. It definitely
Yes.
makes a difference.
Yes.
And is there like a specific amount of time to kind of progress through that spectrum, or is it different for everybody how quickly they lose more memory and start to get lost in things like that?
Very good question. Everyone's different. Typically, it takes years to progress through to the most severe stage of Alzheimer's. But how long that is, that's different for everyone and depends on their risk factors and so on and so forth.
Sure.
Gotcha.
Makes sense. And we do have another question. This question is coming to us, it's a comment rather, from Corax, and Corax says, I've read that there have been some preclinical experiments conducted using focused ultrasound for treatment. Is this something that you have done yourself or read about? What do you know about
that's
this?
not something I've done myself, but I know that there's so much being looked at into Alzheimer's disease, into varying ways to manage this condition and hopefully to find a cure. And we're so glad that so many people are trying so many different things to try and find maybe that one clue that will lead to the big breakthrough that we need to bring finally cure to people. And so I know so much is being done out there.
How about for family members that are in denial? Yeah, because I feel like that has, I have even, been know people like this, that this has affected them, that they just can't not believe that this disease is actually happening.
Right.
What type of conversation do you start with a family member who is in that predicament?
Right, so I begin from a standpoint of understanding. It's a very scary thing, and it's a life-changing diagnosis. So I completely understand why, for many people, that would be something that would happen, just sort of not really being able to completely grasp that this is happening to them. But we're there. Their providers are there for them to continue to talk and hopefully follow with them, over the months and years, and hopefully build that relationship and that trust that will enable them to really begin to open up more and get the help that they need for this condition.
Very good. And we have another question from Dennis. Dennis asks, can you test to see if you have Alzheimer's? Oh, that's interesting. How does testing work?
Yes, very good question. So by and large, the diagnosis for Alzheimer's really depends on the clinical picture. When I say clinical, I really mean that the signs and symptoms that the patient has, and also what the provider sees, gleans from them based on the history and the exam. There's really no one test that can say, oh, you have this condition. But there are, other scans and brain scans out there that can sort of go forward into making the diagnosis even more sure, per se. But by and large, nowadays, the diagnosis is made essentially on just the clinical symptoms that the patient has.
Gotcha.
Yeah.
And we have another question from Brielle. So, is there anything I can do to help a loved one preserve what memory they have left?
Yes.
Good question.
Very good question, Brielle. It's really all about maintaining those interactions, maintaining the cognition that the loved one has. So, keeping them socially active, if at all possible, and just being there and caring for them and being there with them. And of course, following up with their providers are all very important things to help reduce the decline that we do see with Alzheimer's disease.
And of course, there are so many resources out in the community. Are there any that come to your mind, just top of your head, that have been beneficial for your patients?
Yes, absolutely. We do know, of course, even apart from just the family care and the provider care, we do know that the Alzheimer Association has a helpline that one can call, and the number is on their website, and you can look into and call, and they have different groups around the community, support groups around the community that one can join, and so on and so forth. So those are all things that one can look into, and many hospitals out there have the dementia centers that one can look into for multidisciplinary care with the psychiatrist, with the provider, with the neurologist, and all of this really goes a long way into helping those with the condition do better.
Gotcha. Keep that socialization up.
Exactly.
Yes.
So we have another question now from Dennis. All right, do men or women have a higher risk of developing Alzheimer's disease?
Very good question, Dennis. Well, so far the research has shown that it may be more common in women to have Alzheimer's disease.
You know why?
Why that is, we're not completely sure why that is quite yet. Is it because women overall tend to live longer than men? That might be it. But we suspect it's probably multiple different factors. And of course, a lot of work is going into really looking into these questions and giving us better answers for them.
Yeah.
Speaking of a question that might not have an answer, have you seen any sort of environmental factors that could potentially contribute to this? I know we eat a lot of processed food and our air is definitely polluted. Do we see that having an impact?
Yeah, good question. So far, research hasn't shown that environmental factors per se have a direct impact into increasing your risk for Alzheimer's disease. But who knows, as we do more and more and look into it more and more, who knows what might happen.
Yeah.
Does the same go for, I've read using deodorant with aluminum in it, or, various other things could potentially
You hear about all
affect.
these things.
I know, there's so many, but you never know what actually is true.
Yeah.
Exactly, one never knows. And I think you just control what you can control, which just goes back to the whole self-care phrase, making sure you're doing all the things right by yourself, making sure you're working with a physician or provider to control your blood pressure, your cholesterol, all your cardiovascular risk factors. And of course, exercise is important, a healthy lifestyle, healthy diet, all goes a long way.
Self-care just makes such a huge difference in
Yes,
just your
it
overall
does.
quality of life. And
It
it's so
does.
important for us to all practice self-care. And to be honest, it's never too young to start.
Oh, agreed, yeah, absolutely.
Absolutely.
I know I need to do more of that.
Me too.
My cats help. They definitely bring my blood pressure down.
Oh, me too. I'm like taking notes right now. I'm like, okay, gotta step up the self-care thing.
Oh, speaking of, have you seen that people having pets kind of helps them as well? Does that help with the socialization aspect?
It does help the socialization aspect, and I think it also helps with the exercise aspect too, because when you have, let's say, a dog, you have to walk said dog,
Right.
and that of course helps with things. But just having pets and having things like that does improve, might improve that socialization aspect of things, and of course exercise aspect of things too.
Exactly.
Yeah.
And it's never too early to start on that healthy lifestyle. And also the brain exercises is so imperative as well.
Yes.
Yeah, so
yes.
should we be doing everything that you're mentioning as well? Or
Everyone.
We're not too young?
Everyone should be doing it. I think just, the key thing is just living the healthy lifestyle the best you can, and that goes a long way. Continue to work with your primary care provider and, in doing things, and that goes a long way.
Yeah. Well, thank you so much, Doctor.
Thank
I
you.
learned
Thank you.
so much valuable information
too.
from this Facebook Live.
It was wonderful having you
Yes,
on. We
thank you.
appreciate
So
it.
good to be here. Thank you.
All right, thank you guys for tuning in. We'll see you again next time.
Much appreciated, guys.